Now, a mother whose 9-year-old daughter has long COVID has been describing how the pair are virtual prisoners in their own home. Helen Goss from Aberdeenshire also has the debilitating condition and has told BBC Scotland that she fears official figures on the number of children with long COVID could just be the tip of the iceberg. Her daughter Anna has been unable to take part in schoolwork for almost a year now and spends most days on the sofa, unable to walk unaided. Ms Goss says accessing tutoring or physio at home has been impossible. 151,000 people in Scotland have self-reported with the condition, but there are no figures for clinical diagnosis. I spoke to Helen and Anna at their home in West Hill about the devastating impact of long COVID on their lives.
We first got COVID, all three of us, at late March 2020. But we wouldn't have known it was COVID unless it was for my symptoms. Anna and her stepdad had really mild symptoms, but I was really struggling to breathe. So she was fine. A few weeks later, she got really unbelievably unwell. I mean, terrifyingly unwell. Her temperature was 40 degrees. There were times when I couldn't wake her up. She wasn't eating, wasn't drinking. Even the tiniest bit of light was actually painful to her eyes. She had a rash all over her. And it was scary. Honestly, I didn't sleep for about 3 days because I wasn't sure if I'd wake up, she'd still be there. But she's really not recovered since. She couldn't go back to school in the August. We tried and failed. And actually the school said, look, this isn't going to work. Take her home, get her better. But we didn't know what it was.
Do you remember what that was like, Anna? Do you remember what it felt like? How tired were you?
Very. I feel like I had 5% energy every day.
5%, that's not good, is it? And it must have been difficult then to sort of concentrate on things like that.
Very.
Yeah. And it was just too tiring?
Mm-hmm.
Okay, so what happened after that?
The school were really good and they enrolled her onto eSchool, which is the Western Isles online school. That worked really well for about 6 months. And in that time, Anna eventually got a paediatrics referral, and the paediatrician really thoroughly checked her over. She's had so many tests. She's had an MRI, ECG, she's had an echocardiogram to check her heart. She's had multiple lab tests, and everything comes back as normal, as it tends to do with long COVID in adults, and it's the same with children. They just don't come back with anything. It does suggest that we're not looking in the right places, and these tests are maybe not the correct tests to be doing. So I would like to see deeper tests, but at the moment they're not available in the UK. Anyway, she was getting on okay with eSchool. Seemed to be sort of improving very, very slowly. And so we came up to our year anniversary, I suppose, of COVID, and there were small bits of improvement. By this point, she'd been diagnosed with something called PANS, Pediatric Acute Onset Neuropsychiatric Syndrome, which is the most horrific condition I have ever experienced in my life. The inflammatory processes in her body were causing psychiatric symptoms. I can only describe it as it looked like she was having a psychotic break. Mm-hmm. And that would happen quite regularly, and it was absolutely terrifying. But unfortunately, the NHS won't treat PANS, so we had to take on quite a substantial financial burden to go private. We did get treatment in the end for her, and it improved her so much. Simple antibiotics and anti-inflammatories. So I was saying to the paediatrician, she is recovering, but I'm sure this is long COVID. What do you think? She said her hands are tied. She couldn't give her a long COVID diagnosis because there wasn't a clinical definition at the time. And I said, okay, well, that's fair enough, but this is what I think she has. But then we got COVID for a second time. And in July last year, the acute infection was worse for her. But we all recovered, so we were quite relieved. But obviously I was really concerned, would she have another PIMS experience?
Explain what PIMS is.
PIMS is Pediatric Multisystem Inflammatory Syndrome. It's basically a massive inflammatory response in the body following COVID. It can be life-threatening. It's not common, but it's something to be aware of. But after that second infection, she got much, much worse again. And she got new symptoms. The new symptoms were mostly pain, sort of neuralgic pain in her legs, in her hands, muscle and joint weakness. And now she has to use a wheelchair because she can't walk far at all. Every day, we just sit at home. We try and do bits and pieces from the sofa. She hasn't actually done any school since, well, she hasn't really done any since August, I guess, last year. So, and she just doesn't have the cognitive ability at the moment, and she doesn't have the energy.
And I don't want to tire you out too much because I know you get shattered. Could you sort of describe to me how you feel?
Really tired.
Is it difficult sometimes to think about things properly?
Mm-hmm.
And when you try and do schoolwork, what does that feel like?
Stressful.
What kind of support have you had, Helen?
I mean, our paediatrician has been there throughout. And although it's been a long journey, she has now diagnosed Anna with long COVID. The school have been incredibly supportive, although I have asked the local authority if they would provide one-on-one tutoring at home, even just 30 minutes a week, and they don't have the resources to do it.
How would you describe then how long COVID has affected you as a family?
It has absolutely upturned our entire world. I mean, we are really prisoners in our own home. I also have long COVID, not nearly as bad as Anna. So I'm usually exhausted too. I'm just so grateful that I found the Long COVID Kids charity, and now, you know, I'm obviously working with them. Because honestly, without that peer support, I would be absolutely lost. But there's a lack of support for education, home education, flexible education. There's a lack of support within the medical community. We really think that the Scottish Government need to put more funding into long COVID services. I know they've announced the 3 million at the moment, but it's not enough.
So what needs to be done?
We need serious investment. I mean, this is genuinely a mass disabling event. We need to do some data gathering and find out the prevalence. We need to make sure that there is support in place for these children who are suffering at home in silence. No one sees them. And, you know, we just need a wider awareness that long COVID in children is real and it can be devastating. And nobody seems to be listening or really care that much.
That was Helen Goss and her daughter Anna at their home in Aberdeenshire. Well, listening to that is Kevin Deans, who is a consultant chemical pathologist at NHS Grampian. He's been researching long COVID. Good to speak to you this morning, Dr. Deans. Listening to that, what's your thoughts?
Well, I think it just brings home just what a devastating condition long COVID is. And it's just so sobering to hear Anna's story and Helen's story. And it emphasises just how we need to move faster. We need to increase the resource. We really need to build on what we know about the mechanisms that are going on underlying long COVID, because while there are still, people often talk about how there's a lot we don't know about long COVID. I get that. There's also a lot that we do know, and we know a lot more now than we knew a year ago, than we knew 6 months ago.
So what do we know, Dr. Deans? Just tell us at this moment, what do we know about what causes long COVID?
Okay, the key features that have been identified so far are a process called microclotting, an autoimmune process, and we've got evidence of what we call mast cell activation. Now, I can chat you through just a little bit about what they involve. Microclotting, as the name suggests, is tiny little blood clots. I mean, we're talking about blood clots forming in the blood that are anything between about 1,000th of a millimetre in size and at the big end about 0.2 of a millimetre in size. So tiny, tiny little clots. They're clots that contain abnormally folded protein, which means that they're particularly resistant to breaking down. And colleagues in other parts of the world have demonstrated these microclots, pretty consistently in people with long COVID. What we believe is that these microclots are then getting stuck in all the places we don't want them to get stuck. So they're getting stuck in the capillaries and the blood circulation, probably causing reduced oxygen supply to the tissues. And again, we've got some evidence that that is the case. It's possible that they're blocking the blood supply and then the blood supply is being restored. That can cause some damage in itself. So microclots are a key part of this. We've really got pretty strong evidence now that that is the case. The autoimmune story, where the body's immune system attacks itself, we're still teasing that one out. There is certainly evidence of autoimmune activity in people with long COVID. It may well be that rather than that being caused by long COVID, that there's some sort of autoimmune tendency in some people that predisposes them to getting long COVID. We've uncovered a bit of evidence that would suggest that locally. So we're trying to explore that. What explains why certain people get long COVID and others don't. And then mast cell activation is the other bit. And mast cells are part of the body's immune system. And if they release excessive amounts of mediators, that can cause symptoms. And again, we've uncovered some evidence that that's a part. Key thing to understanding that is that it gives us a clue as to what treatments may well be effective.
And Dr. Deans, what do you think about whether or not we need a long COVID clinic in Scotland?
Yeah, I would say absolutely. I think we need that, and we need that pretty urgently. We need long COVID services that bring together folks who are looking into and understand the underlying pathology, the underlying mechanisms that are going on. We need specialists for the various organ systems that are involved, because as you'll gather from what I've described from these microclots, lots of different organ systems can be involved. So it can affect the heart, it can affect the nerves or the brain, and often the sort of symptoms that people present with are neurological. It can affect the chest, and we've uncovered evidence of that locally as well. So we need all those specialists. As Helen said, serious investment is needed. This is going to cost, but I would argue, well, we can't not do this. Long COVID is happening all around us.
And just briefly, Dr. Deans, Helen was pointing to the fact she believes that the official figures could just be the tip of the iceberg, that there are people who have long COVID that we don't know about. Do you think that's accurate?
Yes, I would say so. I would say it's very likely that for everyone that comes to our attention, there are many who haven't come to medical attention or haven't been officially recognised. I mean, one group of people where I think that's particularly the case is people who've developed long COVID type symptoms after having the COVID vaccine. While the COVID vaccine has saved lots of lives and at population level has been a good thing, we're now uncovering evidence that some people are developing this same sort of presentation, long COVID, after the vaccine, and it seems to be that is the thing that has triggered it. And we particularly suspect that people who've developed that are perhaps particularly under-recognised and under-acknowledged. So we do need to get a serious handle on just how big this problem is. There's lots of people there, basically.
Indeed. Well, listen, I thank you for your expertise, and we will follow your research with interest. That's Dr. Kevin Deans, a consultant chemical pathologist at NHS Grampian. He's researching long COVID. Well, we're joined now by the MSP, Alex Cole-Hamilton, who's leader of the Scottish Liberal Democrats, and who's been campaigning for more help for the likes of Helen and her daughter. Good morning to you.
Good morning,
what do you make of, I know you've been listening to the interviews, what do you make of Helen and Anna's case?
Well, it's heartbreaking, isn't it? I mean, to hear a childhood ruined by this debilitating condition. I first encountered Helen and Anna about a year ago at the first meeting of the Long COVID Cross-Party Group that I chair with Jackie Bailey from Labour and Dr. Sandesh Kilharni from the Conservatives. And we asked Helen to tell Anna's story and to define her experience through Helen. And Anna did that in just 3 words. And those 3 words were, "I hate it." And I'm haunted by that. I can just hear the anger and the frustration in those words. Helen talked about long COVID being a mass disabling event. And we've just heard from Dr. Deans that we may just have the tip of the iceberg. There's 150,000 Scots right now suffering from this condition. And we are nowhere. We are well behind England. We're well behind Wales in terms of the financial support being provided by the Scottish Government. And that has got to change.
What do you think we need then? Dr. Deans was talking there about a long COVID clinic. The government says it's spending £3 million a year to help support NHS boards and partners. You have been campaigning for a long COVID clinic, haven't you?
100%. £3 million a year, Fiona, doesn't touch the sides. That's £22 per long COVID sufferers, and that's just the ones we know about. We need long COVID clinics to bring experts together so that we can understand the pathology of this disease. We can get holistic, comprehensive therapies, including physiotherapy if that's required, but also care pathways that they have in England and they're starting to bring online in Wales to Scotland. I don't know why we are offering such a second-class service to Scottish sufferers right now. And I've said this, and I'm not being facetious about this. If you have long COVID in Scotland, you'd be better off moving to England for the care pathway you can enjoy there. It's just really not good enough.
You heard Dr. Deans there saying it could just be the tip of the iceberg. That's his fear, that for all those coming forward, there are others that aren't and simply under the radar. I mean, is this, from what you're hearing and you're picking up and talking to people, could possibly be the case?
Yes, absolutely. We hear anecdotally, I think we've got to remember we've not lost COVID. COVID is still at large in our community. And we've been asked, well, the government policy is clearly that we've got to live around COVID. But that means that we've got to live around what COVID can become. And every day, more people are succumbing to COVID. And by extension, every day, more people will begin to experience long COVID symptoms as well. So this number of 150,000 is really just the starting point. It's being added to all of the time, and the government are still not even out of the starting blocks on our response to that. We're going to have to recognise that this is going to have an impact on whether people can work and what that means financially for them in terms of sick pay. We're going to have to recognise that people like Anna are not getting schooling. So Helen talked about having to access a service in the Western Isles in terms of e-learning. There will be lots of children around the country who are currently trying to do a little bit of schoolwork every day from the sofa, like Anna is. And again, the Scottish government just seem to have the blinkers on to say, look, we've chucked a little bit of money at this, it'll go away. I'm sorry, it's not going away, and we need to do more. What
the Scottish Government has said to us is that they are working with NHS, with clinicians, with young people and families to develop the best models, the best targeted models that address the specific needs of children and young people living with long COVID. So perhaps a more targeted approach is what they're looking at?
Well, I see no evidence of what they're actually planning to introduce, Fiona. I mean, we had a debate, the first debate, and we've had long COVID in this country for at least 18 months, yet the first debate in government time finally happened last week. And it was really for the government just to tell long COVID sufferers, yeah, you've had your tips. This is all we're doing. We're not going to bring in clinics. We're not going to bring in bespoke care pathways like we have in England. So if there was some kind of targeted support on offer, then that would be great. It would be more than we're doing now. But we see no evidence of that, Fiona. And I really think that the Scottish Government have let, the 150,000 long COVID sufferers that we know about, the children like Anna that we know about, and all those that we don't know about, horrendously down.
OK, well, thank you for your time. That's appreciated. That's the MSP Alex Cole-Hamilton, who's leader of the Scottish Liberal Democrats. We did ask to speak to the Health Secretary, Humza Yousaf. He wasn't available, but the Scottish Government have given us a statement. They said that we know it's not only adults who are impacted by long COVID. The pandemic's been exceptionally difficult for the health and mental well-being of many children. This is why we're determined everyone with long COVID gets the care and support that's most appropriate for them, regardless of age. We're spending £3 million a year to support NHS boards and key partners to improve the care and support available for people, including children and young people with long COVID across Scotland. An example of this can be seen in NHS Greater Glasgow and Clyde, where resource has been allocated to support the recruitment of an additional paediatric occupational therapist to provide support to children, young people and their families. It continues. We've also established a national long COVID strategic network. A key priority of the network over the coming months will be to work with the NHS clinicians, young people and their families. Health Secretary Humza Yousaf and Public Health Minister Marie Todd have met organisations representing those affected by long COVID, including Long COVID Kids Scotland, to help inform our understanding of what more needs to be done to meet people's needs.